Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to cure Candida naturally. Candida is a type of fungus called yeast. It's naturally present on the skin and in the human body, especially in the following areas: /r/n/r/n Candida can overgrow and cause an infection. This can be due to the following: /r/n/r/n. The medical term for the infection is candidiasis. /r/n/r/n. The leading cause of candidiasis is the species Candida albicans. However, other less common Candida species can have a similar reaction in the body. /r/n/r/n. This article explains candidiasis and some natural methods that may help treat this common fungal infection. /r/n/r/n. Candida infections are the most common fungal infections in humans. The symptoms of candidiasis vary by the location of the infection. /r/n/r/n. Symptoms of oral candidiasis, oral thrush, include the following: /r/n/r/n. This photo contains content that some people may find graphic or disturbing. /r/n/r/n/DermNet /CC BYNCNDrnrn In. The main symptom of esophageal candidiasis is difficulty swallowing. /r/n/r/n. Symptoms of vaginal candidiasis, yeast infection, include the following: /r/n/r/n. This photo contains content that some people may find graphic or disturbing. /r/n/r/n/DermNet /CC BYNCNDrnrn In severe cases, a candida infection can disseminate. /r/n/r/n. This means it spreads through the bloodstream to multiple major organs, including the following: /r/n/r/n. This is called invasive candidiasis, usually accompanied by fever and chills. /r/n/r/n. The overgrowth of Candida is influenced by many different factors, such as /r/n/r/n. Additionally, some foods may fuel Candida's growth. Studies have shown the following may speed up Candida growth. /r/n/r/n. Oral thrush is typically diagnosed by a healthcare provider looking inside the mouth. /r/n/r/n. Esophageal infections are diagnosed by endoscopy. /r/n/r/n. Vaginal yeast infections are diagnosed based on a vaginal lab culture. /r/n/r/n. Antifungal drugs are commonly used as a first-line treatment. They are either topical, applied to the skin, oral, taken by mouth, or given intravenously, into a vein. The type of treatment will depend on the location of the infection. /r/n/r/n. Some vaginal infections may be treated with over-the-counter, OTC, topical medicines. However, all other Candida infections typically require prescription medications from a healthcare provider. /r/n/r/n. Here are the recommended treatments for some common Candida infections. /r/n/r/n. Oral thrush. For oral thrush, antifungal lozenges or suspensions are applied to the mouth. In more severe cases, an antifungal medicine called Diflucan, fluconazole, is taken by mouth daily for 7 to 14 days. /r/n/r/n. Vaginal yeast infections. For vaginal yeast infections, topical antifungals are applied to the vagina, usually for 7 to 14 days. These topical medicines include the following: /r/n/r/n. Oral medicines for vaginal yeast infections include the following: /r/n/r/n. The evidence supporting the use of natural remedies for candidiasis generally is weak. /r/n/r/n. Lifestyle changes like the following may lower the risk of candidiasis, though they're unlikely to treat active infections. /r/n/r/n. Dietary supplements are not regulated like drugs in the United States, meaning the Food and Drug Administration, FDA, does not approve them for safety and effectiveness before products are marketed. Whenever possible, choose a supplement tested by a trusted third party, such as US Pharmacopeia, USP, ConsumerLabcom, or NSForg. Keep in mind that even if supplements are third-party tested, they are not necessarily safe for all or effective in general. Therefore, it is important to talk to your healthcare provider about any supplements you plan to take and to ask about any potential interactions with other supplements or medications. /r/n/r/n None of the following remedies have proven to treat Candida on their own. /r/n/r/n However, they may help support over-the-counter or prescription antifungals your healthcare provider prescribes. /r/n/r/n They include the following. /r/n/r/n Here's a quick rundown of the latest evidence. /r/n/r/n Probiotics are e-foods or supplements that contain live microorganisms intended to maintain or improve the good bacteria in your body. Probiotics include, but are not limited to, the following: /r/n/r/n Vaginal yeast infections. Probiotics lower the pH in the vagina and can act as a barrier to yeasts like Candida. /r/n/r/n According to a review, probiotics were added to conventional antifungal medicines. They increased the likelihood that a vaginal yeast infection would be cured and not recur within 1 month. Researchers confirmed that the quality of evidence for the trials they reviewed was low. /r/n/r/n In one study, only about 14% of females using a vaginal insert with 2 probiotic strains had a subsequent yeast infection during the first 7 months of probiotic treatment. This was lower than the typical recurrence rate, around 50%. /r/n/r/n The long-term prognosis of probiotic supplementation for yeast infections has mixed reviews. /r/n/r/n Oral thrush in denture wearers. Probiotics may benefit people with oral thrush because they decrease the amount of Candida. People who wear dentures may see the most significant benefit from probiotic supplementation. /r/n/r/n A trial of people who wore dentures and harbored Candida determined that those supplemented with probiotics had decreased fungus levels and may be less likely to develop thrush. /r/n/r/n According to another study of denture wearers with candidiasis, a product made of 3 probiotics for 5 weeks lowered candidiasis to only 16%. This was compared to 92% of people who used a placebo. /r/n/r/n Taking probiotics along with the antifungal medicine nystatin has been shown to decrease the treatment time of oral thrush by up to a week. /r/n/r/n Preterm infants. Probiotics may prevent Candida from colonizing babies born prematurely. This may prevent fungal sepsis, a blood infection, but more clinical research is needed. /r/n/r/n One trial found that lactobacillus was as effective as nystatin in preventing candidiasis in preterm infants. /r/n/r/n In addition to probiotic supplements, many yogurts also contain probiotics that could be helpful for candidiasis. /r/n/r/n Prebiotics are nutrients that stimulate the growth of healthy bacteria in the body. By increasing good bacteria, prebiotics can better keep fungi like Candida under control. /r/n/r/n Prebiotics are found in asparagus, garlic, bananas, and honey. There are also prebiotic supplements, such as lactoferrin, that you can take by mouth. /r/n/r/n However, clinical evidence to support prebiotics for candidiasis is lacking. /r/n/r/n According to a clinical trial, doses of 300 international units, IU, of vitamin D daily may help prevent candidiasis in children with critical illnesses who are on antibiotics. /r/n/r/n Medium-chain triglycerides, MCTs, may be beneficial in preventing the growth of Candida in the gastrointestinal, GI, tract of preterm infants. /r/n/r/n. While Candida in healthy infants typically doesn't pose serious problems, preterm babies are more likely to have invasive fungal disease caused by Candida. This is due to their weakened immune systems. /r/n/r/n. As prevention for candidiasis in these susceptible infants have only been studied in very small trials. More data is needed to validate these findings. /r/n/r/n. Other supplements that have been studied for their use in Candida include the following. /r/n/r/n. Human data is needed to determine what effect, if any, these supplements may have on Candida infections. /r/n/r/n. Most Candida infections will resolve within a few days of starting antifungal medications. /r/n/r/n. Contact your healthcare provider if you are still experiencing yeast infection symptoms a few days after finishing antifungals. /r/n/r/n. Candida overgrowth is typically treated with antifungal drugs. However, natural remedies may support the treatment of yeast infections and oral thrush. /r/n/r/n. These include the following. /r/n/r/n. The evidence supporting supplements for Candida infections is weak. Relying on natural remedies alone to treat candidiasis is unlikely to resolve candidiasis. /r/n/r/n. If a Candida infection is left untreated, it could spread throughout the body. Appropriate treatment must be started promptly. /r/n/r/n. If you decide to try a supplement for candidiasis, it's best to take it in addition to antifungal medicine and only after consulting a healthcare provider. /r/n/r/n. Candida is a fungus called yeast that is naturally present on the skin and in the human body. An overgrowth of Candida can cause infections like oral thrush and vaginal yeast infections. /r/n/r/no. Antifungal medicines applied to the skin or taken by mouth are the standard of care for treating Candida infections. Although lifestyle fungus and supplements, mainly probiotics, may benefit people with candidiasis, there isn't enough evidence to recommend them apart from antifungal medicines. /r/n/r/no. Candida is not an STI because you can get a Candida infection without having sex. That being said, yeast infections may be passed through sexual activity, and they are more common in people who are sexually active. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.